Hi, this is Dr. J. Wes Ulm with my video to accompany my interview for Luke Kervin's 5 Steps to Improve the U.S. Healthcare System series. I'm going to keep this brief since my answers in the interview itself are quite extensive. Also, naturally, this is informed by the times we live in right now in July 2021 with the COVID-19 pandemic and the Delta variant in particular raging. A lot of these suggestions are naturally informed by that, in particular things like mitigating physician burnout and the physician and healthcare staff shortage. Also, a lot of this is going to be preaching to the choir. Many of these points have been raised before in many circumstances by other physicians and policy experts, but it's nice to have them all in one place. So without further ado, the first step that I talk about in the interview is streamlining of the EHR, electronic health record system. Again, as many authors have indicated, this was a once great idea and a wonderful addition to the healthcare charting system that, like many other great ideas, has suffered from mission creep. And the charting system as it is right now often adds so much onto the daily physician burden that it can extend, into the wee hours of the morning, as many of my own colleagues have told me. And this is a major contributor to physician burnout and staff shortages. Again, one thing we absolutely want to avoid in the midst of a pandemic like this. And so in the interview, I discuss some steps to improve it using Taiwan in particular as a model, where I did an overseas externship and saw a very efficient charting system, mainly just above all, recentering the focus on patient care as the key for doing the HR charting and minimizing its sort of ancillary use for things like billing, authorization, and as a sort of a risk management tool. The second point that I bring up, second step to improve the healthcare system, involves streamlining of the physician training pipeline. Again, just briefly, since this is covered in detail in the interview, the U.S. system is essentially based on a 19th century model in Germany, thanks to in large part its founder, Dr. William Halsted, a Johns Hopkins pioneering surgeon in the late 19th and early 20th centuries. However, with the explosion of knowledge that's happened in previous years and just also sort of exogenous changes in the broader U.S. economy, inflation, and things that make sort of kind of starting life milestones like getting a home and starting a family much more challenging, it's useful to rethink that. And I have some thoughts on that, again, in the detailed interview. The third step, again, an inevitable topic in a discussion like this is, again, revisiting the question about universal health care in the U.S., naturally, in this case, informed by the COVID-19 pandemic and why it's important. I talk in the interview about how single payer is just one of many different universal healthcare approaches, which is a very important point to emphasize. One of the hurdles brought up in moving to universal healthcare for the United States is how different it would be from our current system and how it might be a bridge too far. Well, I point out how the U.S. is hardly alone in that. How there are many other countries with systems like ours who've evolved in a more universal direction. For example, France's multi-payer system and others around the world, and also why this is so important right now in the pandemic by reducing, in a sense, the barrier for many patients to get tested for COVID, to get vaccinated, just to have the sort of connections that are important with healthcare providers to do tracking and tracing and just try to bring the pandemic under control. Again, with a direct connection to how this is expedited in countries with universal health care and how this can be accomplished realistically in the U.S. Fourth point I bring up is regarding healthcare communication. And in improving some of the steps for this. This is, if anything, maybe more of a public health issue and maybe a media issue, just kind of gets into the different stakeholders involved in healthcare communication, but very, very important naturally right now with the COVID-19 pandemic and encouraging things like masking, vaccination, social distancing, infectious control steps. It's critical, as I emphasized in the interview, to avoid a kind of shaming and guilt-based approach, or any sort of indication of condescension or talking down to patients, and put a greater focus on respect, dignity, autonomy, risk-benefit calculations, particularly to encourage things like COVID-19 vaccination, and various other steps that can be very critical for helping to bring the pandemic under control. Again, the pandemic, if anything, is sort of emphasizing these issues and bringing them into focus. And the fifth and final point I may just make in the interview in a very different arena is a suggestion on improving the pipeline of multilingual physicians with broader cultural awareness. As emphasized in the interview, this is something that ideally would be started long before medical school, even as early as grade school and elementary school. But again, one thing I noticed working in a number of other countries doing medical externships and conferences, not only in Taiwan, but also in Singapore, in China, Japan, Germany, Austria, is that the physicians tend to be quite multilingual and able, have a lot of fluidity in tackling some of the nuances of different cultures, and that's simply in part because they start, fairly early in their schooling. In the United States, obviously, Spanish is useful for this, is essentially a de facto second language for the country right now. But other languages also are useful to pick up early on in one's schooling, so that when the pool of physicians is molded years later in medical school, a larger number of those individuals will have those multilingual skills, which can be valuable, particularly as the United States continues to diversify. And so that's pretty much it. That's, again, a quick rundown of my 5 suggestions for improving the U.S. healthcare system for Luke Kervin's interview series. I spell all these out in greater detail in the interview itself. And I'm always happy to see anyone's comments on these ideas, and very thankful to Luke Kervin and the team at Authority Magazine for this opportunity.